we have so many people coming out, and the main important aspect of this webinar is to help out the youngsters to find a toehold and what next to do once they pass out, because pediatrics itself is not only an option, what next to do. And we have a very good speaker today, Narayan sir, who will be speaking today. I now invite our President, Nanduma sir, to say a few words.
Good evening, respected chairperson of our action plan, Dr. Narayan, and today's speaker, Dr. Narayan, Dr. Gopi, Dr. Shimmi, and Dr. Kamath sir, Dr. Nandesh, and other dignitaries on this platform, my dear friends. As Dr. Gopi already mentioned, there is a sharp increasing number of PG seats and regular fall in birth rate in Kerala as elsewhere in India. That definitely reduces the job opportunities. And more than that, the number of infectious diseases are coming down, thanks to our effective vaccination drive and hygiene, increasing hygiene. And other factors which affect our youngsters' career is corporatization of healthcare, worsening doctor-patient relationship, then so many other factors. Then keeping all this in mind, we thought we should have a plan to help them. That is why we formulated this action plan under the able leadership of Dr. M. Narayanan. As you all know, Dr. Narayanan is a very successful practitioner in Kochi and is past president of IAP Kerala, and he's a very good organizer. And last, that Kochi Pedicon, as you all know, that shows how able as organizer Dr. Narayan is. So I request all our youngsters, and we are planning CMEs and even offline programs, and we had one workshop at our state Pedicon at Trivandrum. So I request all youngsters to make use of these webinars and our action plan. And today we have a launching, first webinar in this action plan. Dr. Narayan, our action plan chairperson itself, he is going to talk about this. So I wish all the very best for this program. Thank you.
Thank you, Nandumar sir, giving us of what this webinar is supposed to be. Now, without wasting much time, I think we can go directly to the webinar. I now invite our speaker, Dr. Narayan. Sir, 1 minute. We had Joe sir has just entered the meeting. Before we start, I would request Joe sir to say a few words. Joe sir.
Thank you, Dr. Gopi, respected President Dr. Nandakumar. Today, the faculty, Dr. Narayan sir, and all the faculty. I wish you all the best program. Over to Gopi Mohan for further proceedings.
Now let's start the webinar to answer.
Yeah, visible.
Yeah.
Visible.
Visible. Is the screen visible now?
Yeah, visible. You can make it full screen, I think. Yeah. It's okay. Just can make it full screen. And
There is the slide share. Slide show. Okay. Okay, good evening to you all. First of all, thank you, President Dr. Nandakumar, for taking this important program of empowering the young pediatricians in his action plan. And we have already conducted one program during our Pedicon at Trivandrum. So today's topic is youngsters, how do you start? It's a very short, brief talk, just less than 30 minutes, and we'll have some discussion also. So I acknowledge the contribution by my four panelists at Trivandrum, Dr. Nandakumar, Dr. Harikumar, and Dr. Arun. And we have taken this topic at the Yuva program at Ahmedabad Pedicon. So that you can see Dr. Afsana Patel and Dr. Narendra and Dr. Yogesh and Dr. Anuja, along with me as the past panelists. Yes, qualified pediatricians in India, MD, DNB, DCH. And this is a convocation C, very common in medical colleges and almost all professional colleges, unlike the previous years. So they're all happy, sharing a very happy moment in their life. So they have completed the training. Now they have to build their career. How do they do it? It's a Kerala pediatrics at a glance. Pediatric postgraduate seats in Kerala from year 2000 to 2025. From 75 seats, it has gone up to 350. That is nearly a 5-fold increase in the number of PG seats in Kerala. We have not considered the postgraduates who do their course outside Kerala and come back to Kerala for practice. At the same time, the childbirths in Kerala has fallen from 5.16 lakhs to 3.28 lakhs between 2015 and 2025. So that's a glaring picture. And regarding the declining birth rates, it has been consistently falling from 5.16 in 2015, 4.96, 5.03, 4.88, like that. Every year it has been falling, finally reaching at 3.28. 3,28,234 is the birth rate during the year 2025. And if you see the graph, the diagram, all districts are doing the same thing, the same pattern. In no one district, the birth rate has been remained standstill or has gone up. So that's the declining birth rate scenario in Kerala. So 5.16 lakhs to 3.28 lakhs. That's a 37% decline over 1 decade during the last 10 years. This sharp decline, it actually directly impacts the patient base for practicing pediatricians across Kerala. So now it's February. March, pediatricians will say that it is the exam month, so patients are less. Then April, May, summer vacation. Again, children have gone to the grandparents and some outings and all, so less patients. June first 2 weeks, rain has just started. The OP has not picked up. Then slowly it picks up. July, yeah. Then due to heavy rain, sometimes OP numbers are less. July, August, okay. Then the autumn season comes. Then September, October, December again the Christmas season, vacation, and things like that. Actually, it is the basic decline in birth rates that has resulted in the fall in the outpatients as well as inpatients in our state. For that matter, across the country, it is like that. It's not only the seasonal variations, it is actually the number of children, their number is declining. You look at this graph diagram, that 0 to 4 is green, 6.5%, and orange one is 6.8%, that is 5 to 9 years. So 0 to 9 years, it comes 6.5 plus 6.3, that is 13.3. And the bluish one, 14.3 is the light blue, that is the adolescent group, 10 to 19. So if you take the 0 to 4, 5 to 9, 0 to 19, if you take, it will be nearly some 28%. This 28% was the percentage of children less than 12 years 2 decades ago. So that's the importance of including the adolescents also in the pediatric age group and the pediatric target group for practice. Then only we can compensate for the loss that we are having due to the fall in birth rates. And of course, 41 is the biggest percentage, that is the 30 to 59. And above 60, we have nearly 16.5%, which is much more than the children's percentage, that is less than 9 years. Less than 9 years, only 13%, whereas above 60 years, it is 16.5%. Not only in Kerala, everywhere in India, the population growth is slowing down. Right from 1951, 1.3, then 20. Actually, it has been the annual growth of the population has been declining 1.2%. At some years, it was 2.2 like that. So there is a declining trend in the population across the country and also across the globe. If you look carefully, see that in 1974, the global population, world population was 4 billion. After 25 years, it reached 6 billion in 1999. That means a 50% increase. Then another 50% increase to happen, we had to wait for 50 years, not 25 years. So 2046 only, you will be reaching the 9 billion population. That's the estimated population. So across the globe, the population rise is on the fall. Also, the global fertility rate. See, in 1955 and all, many countries had fertility rate above like 6.5, 6. Above 3, something like that. But now only in Africa has got a fertility rate which is highest, 3.95, nearly 4. All other continents, the fertility rate is below 2.2, including Asia and Latin America. We are also standing below 2.2. See the trend in PG counseling, the specialty preference trends. If you take the first 100 rank holds in all India counseling, there are 100 candidates. Pediatrics is opted by only 1 candidate in 2025, 2 candidates in 2024, and like that from 2021 onwards, 2, 5, 2, 1. That means 99% of the top rank holders, they don't want pediatrics. They would rather like to have medicine or radiology. So that's the preference. That is due to the what they consider is the scope after doing post-graduation. Apart from the fall in birth rate, migration of population to other countries like Gulf, Canada, UK, Ireland, Germany, and you are in your OP, you will be seeing a lot of parents taking their children to foreign countries. And if you look at that map, Kerala is 167, means 167 people are migrating per 1 lakh population. So it is third only to UP 178, Bihar 168, and Kerala 167. I don't know where these people from UP are. Once they are top in the list. Which place they are going, I don't know. Apart from these two factors, other contributing factors. Actually, these factors are contributed by we pediatricians only mainly. Changing disease profile, as Dr. Nandakumar has put it, fewer infections. Now it's more lifestyle diseases. Thanks to the successful immunization programs, where especially under the leadership of pediatrics, it is happening. We have been successful in eradicating polio, and diphtheria and tetanus are now very rare, you know that. And there is significant reduction in other infections like hip, pneumococcal or diarrhea, rotaviral diarrhea. All these infections are coming to lower incidence. And we have been supplementing vitamin D to right from neonatal period to 1 year. We know that vitamin D improves the immunity and reduces the infections in infants and young children. We have been advocating zinc in diarrhea. And if you give zinc for 2 weeks during diarrhea, the chance of getting diarrhea next to 3-4 months is very less. And probiotics, they improve the immunity. And preventive therapy in asthma using MDI, the results are very good. Reduces asthma, recurrence, admissions due to asthma. Everything is reduced due to the preventive therapy. All these things are very good because when you are aiming at health for all, these preventive measures are very important. And this is how a country should progress. I have a friend still. He, after completing MBBS, he set up a clinic in a small village. He was very passionate. He worked hard and was available throughout. And after maybe 1 or 2 years, actually the incidence of disease in that village came down to the extent that he could close his clinic and go for some other profession. Because when you are doing good work, definitely the incidence of disease will come down. And that's a positive side of that. We should take it as positive, not negative. Right now, the working environment today, we all agree that we all know every day we see reports of increasing corporatization of health sector. It just made difficult for small hospitals to survive. Long duty hours with low salaries are the complaints by junior as well as senior doctors. And our specialization pressures, especially when pediatricians are specialized in subspecialty or super specialty, they are not in a position to see general pediatric cases, so that they should get the feeds from that particular specialty only. Then, of course, contract issues and target meeting, that especially in big corporate hospitals, that you have to see this number of patients daily or meet this much of amount IP, everything has to be done. That culture is gradually coming. And you all know that pediatric generates relatively less revenue in hospitals. And of course, there is not very common. There is, in some places, there is unhealthy competition among hospitals. And recently, practice attached to residents is not feasible in many urban areas, because in urban areas now, many doctors are staying in apartments, or even the parking facility is very less for even individual houses. So the residential practice is not very attractive nowadays. And of course, not only in pediatrics, in all medical degrees, our retirement is very low, or practically no retirement. We never retire. Only thing is when we are supposed to quit our work due to some illness or some other problem. That's because that's a culture we have that we cannot change, because doctors, after they don't know what to do after retirement, whereas bank managers and all, they go to some Palli committee or Ambal committee and they enjoy like that. But doctors, actually, they don't know, they are not prepared for retirement. Then comes the patient-doctor conflicts. It's a growing challenge for young doctors. Patient load, more patients per doctor in government sector and less patients per head in private sector. Actually, the private hospitals have doctor load because they are loaded with the doctors. The patient load is more in government hospitals. Lack of facilities, of course, resource constraints mainly in government sector. And defensive medicine, because number one, fear of litigation and fear of physical attack also. These two leads to unnecessary referrals and unnecessary tests also. Hospital attacks are a very serious concern. Actually, junior doctors are usually at the receiving end in violent incidents. Increased patient load in government hospitals leaves less time for adequate explanation and getting empathy from patients. Communication is difficult when the patient numbers are more. And of course, lack of facilities fuels frustration among patients and families. Then from our side, inexperience, ego, and sometimes impulsive reactions can escalate the situation. This finally results in a culture of defensive medicine and unnecessary tests and referrals. Another area is the social media, which is a double-edged sword. We are all familiar with the Google Doctors. Patients self-diagnose before visiting us, then YouTube, Insta, Facebook. This gives most of the time they give information as well as misinformation, especially from non-medical sources. And AI tools are there. The negative comments and reviews affecting the reputation of the hospital and institution. And of course, in Kerala and in India, alternate medicine promotion and mixopathies. So this is an area, whereas there is an opportunity. So we have to build our own positive digital presence to counter this misinformation. So that's the positive side of it. There's a platform for building positive reactions in medical science. So I have been telling about the problems. Of course, for any problem, there will be a solution. Emerging opportunities. Wellness clinics. Is it a solution? It's a new practice paradigm for emerging pediatricians. Comprehensive, child care beyond just illness management. So we should focus on child care, not only illness management. Then preventive health, nutrition counseling, and obesity management, and developmental screening and remediation. Growth monitoring programs in adolescent health services. Then structured programs like half birthday celebrations launched by your Vice President, Dr. Jose, has been a very successful program. So similar programs we should have. Then we should focus also on chronic condition management, like learning difficulties, autism spectrum diseases, instead of just sending them to psychiatrist or developmental therapist. We should also have a say in the management of these problems. Then, as I told earlier, expanding the scope of pediatric practice. What we can do, we can extend the pediatric age bar to 18 years, compensating for the reduced birth rate. It may be possible in private sector, but I don't know. Government sector, they are already overloaded with the age group up to 12 years. So so many logistical problems are there. But generally, to get that 28%, we should include day 1 to 18 years, full life cycle pediatric care. Then only pediatricians will have sufficient work to do. Then manage lifestyle diseases of adolescents. It's a growing need. Then growth monitoring at all stages of childhood. It should not be limited to infancy and early childhood. Throughout the childhood, we should do the growth monitoring. So we can pick up even children for growth hormone therapy and things like that when they reach the adolescent. So growth monitoring should be at all ages, throughout childhood. Then well baby clinics and preventive health programs. Then counseling facilities wherever possible for behavioral and developmental problems. So anyway, you know all these things. Then how do you build your career? Let us have a look at the practical guide. Choosing our base is very important. Whether you like to practice in the rural or an urban setup. Rural practice just got its own advantages and disadvantages. Would you like to practice in your own village or a familiar area, or a nursing home or a clinic-based setup? Or the distance from the tertiary referral centers are important, because until the patient reaches the tertiary center, you will not be able to sleep. So if the center is closed, then better. Otherwise, you'll have to keep hours without sleep. Of course, stronger community trust is there in rural setup. And here, lower initial investment is required. Whereas in the urban practice, it can be clinic, nursing home, corporate hospital, or anything like that. And tier 1, 2, 3, depending on the demand. And should have a very careful site and area selection. Do not select a place very close to leading practitioners, roaring practitioners, senior practitioners, then it will be difficult for us. The new residential areas, it will be coming up. There is a scope for that. We have to study that. And we have to decide whether we should buy one clinic or get one for rental, or we should be a part of a polyclinic or a corporate hospital. So in urban setup, there are so many options. Anyway, we have to go not at a sitting, but to go step by step. So we have to prepare a business plan. So it is said that failing to plan is planning to fail. So that is important. You should have a very pakka business plan. And you should procure financing. You should procure quality equipments, not chartan equipments and all. That will damage your credibility. Then you should have a very good trained staff. You should select good software for billing. And finally, in the present era, you should do some marketing also. Market your clinic. Financial planning it should be a realistic planning. Should have realistic expectations. Income takes time to come. Once you start the practice within a year or within 2 years, you may not get the desired income. You'll have to wait and wait. So youngsters should be ready to wait until they get a good result. And you should do things in a phase-wise manner. Otherwise, it will be a tension for us. And as I told earlier, renting makes financial sense for the youngsters rather than buying a property. But you should avail loans with caution, because banks they have the interest which initially may seem very trivial, but towards the end how much you are paying as interest. So always weigh your repayment capacity, and you have to save consistently. Don't wait. I will say after 50 years like that. You have to start saving from early practice. So saving is equivalent to earning. Clinic design. So always the first impression matters. So the child-friendly decor and colors must be there, should be there throughout. These are from 2 clinics in Kochi. Clear separation of sick and well child if possible. And should have a dedicated immunization room with a cold chain. Private consultation room for sensitive discussions, not to be misused. Then accessible washroom facilities. And if possible, good ventilation and natural lighting. And should have a very good reception and waiting room. Warm and friendly communication between receptionist and parents is a must. Should be priority for sick child at no extra cost, because that builds an immediate trust. A dedicated feeding room is a must, and a safe play area if possible. And it is better to avoid shared periodicals and magazines, because they become sources of infection. And you should know at the clinic, know your patient and family should have a personalized care, and create a truly child-friendly environment at every touch point. And when you look at your clinic, you should look at you should have a perspective of a child. How the child sees my clinic, that should be our perspective. And if possible, and try to give all services like immunization, dietetics, counseling services, everything under one umbrella is, if available, that will be a good service. And support and accommodate children with special needs. And grandparents, influential visitors, and VIP patients, they may appear as headache, but they have to be handled with care in the present setup. And finally, know what you don't know. That will help you to refer appropriately at the appropriate time. If you don't know about the diagnosis, or you are not likely to get the diagnosis, or you don't know the treatment, or no, you will not be able to treat the patient, immediately refer. That will be good for the patient as well as good for us. And outside your clinic, you should have a presence in the community and a digital presence. Community engagement. Of course, patients are your best advocates, but that alone is not enough. You should provide parenting tips and handouts. And where if medical camps or school health camps or community programs are available, try to attend those programs. And when there are parenting group meetings, like those in the nursery schools, play schools and workshops, things like that, you make your presence feel there. And digital presence is very important in this digital era. Google, LinkedIn, Insta, Twitter, and all. Or a simple professional website. Regular, accurate social media updates should be there. Should be accurate. That's very important. And you should share evidence-based content which will be useful to the community. Appointments and payments. Appointment-based practice is ideal because it saves time for parents, children, and for doctors also. Assign a dedicated person for managing appointments, calls, and payments. And you have to set our consultation fees based on experience, seniority, and the local norms. Because consultation fee structure varies from place to place. I think pediatricians in North Kerala are the masters in it. They charge consultation fees for 7 days. One slab for 7 days, and after 7 days, they have to renew. Whereas in the Central Kerala and the South Kerala, it is, I think, minimum 2 weeks period is there. So as far as possible, give that time period, keep it as 1 week or 10 days like that, because usually one illness, uncomplicated illness can be treated within 1 week. If that particular illness goes beyond 7 days, then it is a serious case, or it is another problem. Any fever more than 7 days, or any illness more than 7 days is a serious problem which requires either admission or further treatment. No point in treating a patient for 2 weeks on single consultation fee slot. I don't know how the hospital authorities will react to this. Then aim for consensus fee standards within our peer community. Whether IAP can do anything on that, we should see. And cashless payment options, if available, because cashless is the style now for everything. Even in the grocery shop, they are going with the cashless idea. So we should also be able to provide that. And immunization still is the core of pediatric practice. So maintain a robust and efficient quality system at all times. Display an updated immunization schedule. Use an attractive professional card, immunization card. And please avoid file folders gifted by pharma companies. We should use only government or IAP schedules. And we should stay informed about schedules used in other countries, because for NRI families, that will be very useful. Ensure that all staff are trained in immunization protocols and be fully equipped to manage anaphylaxis emergencies and any similar emergencies. The most important part is the communication, a triad, where a child is there, pediatrician is there, and parent is there. It's all important is the communication. If you are good in communication, there will be fewer investigations, fewer medications, fewer referrals, and better outcomes. We cannot take a class on communication, because communication has to come from your side, from your heart, from your mind, from your mindset. It has to come. Even if you don't annoy the parents or children, that's enough. When they come out with some suggestions, if you just keep quiet, that itself is a good communication. Annoying the patients and parents, that's the worst part of our communication. So we should, especially the youngsters, should develop a good art of communication. And of course, managing phone calls is professionally. So when you are seeing a patient, you get a call, then you should say, I'm seeing a patient right now. Is it urgent? If not, I'll call you later. And like that, you should without irritating the patient as well as the caller. You should settle the things. And as far as possible, avoid prescription by phone because it carries significant medico-legal risk. If unavoidable, only suggest previously prescribed medications. Never prescribe antibiotic or new drugs over the phone. Do not manage sick children via phone consultation alone. So that will be dangerous. We all know these things that patients are often anxious about even minor deviations from the lab values. But never dismiss their concerns because it is due to their ignorance and ignorance and tension that they are telling. We should tell the patients to acknowledge and explain the truth. Explain why a slight variation is clinically insignificant because labs have the tendency to put in bold letters all the abnormal values. It may not be very significant or not at all significant. And of course, order minimum necessitates that will improve our clinical skills also. And documentation, our interpretation and reasoning, it should be recorded. Even in the OP ticket, you can record it. It will be useful next time for us or any of our colleagues. And sometimes they suggest some tests, but you may feel that it is not required at that time. But outrage, don't deny that. Because if they do the test and come with the result, there may be some anomaly which we might know. It may not be significant. For them, it may be very important. So, what are the guidelines for good clinical practice? Most important is follow rational treatment protocols, either by the government of India, government of Kerala, or IAP or IMA. There must be a protocol that is based on evidence and must be always patient friendly. Never quarrel with parents. And clinical examination, meticulous, thorough examination of every patient will give you rich dividends. And identify sick patients promptly. Identifying a sick patient is very important in our profession. And refer as early as possible. Finally, the correct diagnosis, correct drug, correct dose is important, and correct duration. And most important is the timely review. Legal aspect, of course, practice legally and ethically at all times. Obtain all required licenses before commencing the practice. Issue medical certificates carefully and accurately. Be prepared to provide emergency care whenever and wherever possible. And you should maintain ethical relationships with pharmaceutical community. There must be ethical relationship. And we pediatricians should follow the IMS Act, especially if managing neonates. And we should join we are encouraged to join IAP medico legal group and attend relevant CMEs and conferences regularly. Financial security, as far as IAP Kerala is concerned, we have a separate group for that. Our experts are there. And 4 things, professional protection, we have the IMA PPS scheme. And for youngsters, it is to take term life insurance because here the premium is less. And should ensure that adequate mediclaim is there because all the hospital expenses are now very high. And youngsters, I would advise them to take mediclaim with a big amount like 50 lakhs or 60 lakhs like that because after age of 50, it will be very difficult to increase the amount. And the premium will be very high. And you should have a good chartered accountant and a very reliable financial advisor because we are not experts in all aspects of finance. This is very important, balance of life. Health, work and family. 3 things are there, but we have only 2 hands. So we should balance the 3 things. Health and sleep. Adequate sleep every night should have a fixed work schedule wherever possible. And one should never be available 24/7. If one person is telling that he is available 24/7, I think we should not take it as a credit. There will be some handicap somewhere that will result due to that 24/7 availability. And the regular access routine should be there. In the family and social area, always find time for family and your family, not other families. Develop a hobby outside the medicine. Regular trips with friends or family is very good. Then you should build friendships outside your profession too. You should not always stick on to the medical fraternity and community. There should have a role in other associations like Rotary, Lions, and things like that. Then profession, effective time management, and set firm on call times, attend CMEs and conferences, and most important, you should mentor junior colleagues because they need our help, and we too need their help. In any profession, there will be some do's and don'ts. So we should be very sincere and consistent in our care. We should generate good reviews through excellent service. Stay in touch with teachers and colleagues. Be an active member of professional associations. Keep time for continuous professional learning. And build good relationship with the neighborhood community. Don't be overly self-sacrificing. Your well-being. Never undercut peers' fees. That is bad for the profession. Avoid criticism of colleagues in front of patients. And never make statements in anger, which you may regret later. So what are the take-home messages? Number one, select the right place at the right institution for your practice. Number two, target units to adolescents. That will expand your scope. Number three, acquire good communication skills with children, parents, and families. Number four, practice ethical, evidence-based medicine at all times. Number five, draw a conscious balance between health, wealth, family life, and profession. If you can do all these things, you'll be a successful pediatrician in your career. Thank you for your patient listening. Thank you.
Gobi.
Yeah, Narayan sir, that was an excellent talk and it is very informative. The session is open for discussion, and I'm very sure that youngsters will find this session very informative and very helpful and will help them in future also. We will be continuing with these sessions once in every 2 months with various topics and speakers, and I hope that we will have enough attendance for this webinar because it is morely aimed at the youngsters than us people who are already settled. Forum is open for questions.
So excellent session as expected. So as I think he has already described everything, all required things for a youngsters to start their practice. What should be done or what should not be done. That is very good. And 2 points I want to enlighten is one is well-baby clinics, strengthening the well-baby clinics. That is the most important thing we have to strengthen. That is my request because well-baby clinics are going to be the bread and butter for next generation pediatricians. We have to encourage everyone, especially the 6 months follow-up is very, very important, not only for us, but for the patients also it's very important. Then second thing is finance. You have to concentrate in finance, learn something because being a financial literate is very, very important. And just like our older generation, we should not be like that because saving is as important as earning. And as what we from this talk, what we know that doctors profession is no more a high earning profession. So definitely you have to find out a secondary income, or at least you should know how to protect the hard earned money. So every youngster should have a financial literacy, and for that also we have a separate thing in IAP. We have a finance group is there. You can all become a member in that finance group. We have a WhatsApp group, and we are also planning the regular bi-monthly webinars on this our finance matters. And there are experts in our own field, our own this community. I think they will guide you what to do. So I wish all the best. I hope that in the further this will have much more programs like this in the future. Thank you, Dr. Narayan and his team. Thank you very much.
I now request Dr. Pinukuttan to say the vote of thanks, and we can wind up the session.
So thank you, dear Nandakumar sir, Gobi Mohan. And actually, this is one of the most efficient talks we had. And definitely, I am sure that this is going to be the most popular talks when we upload it in YouTube. So thank you, Narayan sir. And this is going to be very useful for all the young pediatricians and all others. Thank you once again.
Thank you. Thank you.
Thank you.
Thank you.
all.
Thank you.
Thank you.
Good night.
Thank you all.